Yes.
Got it. And I just clicked got it, that the recording is in progress as well. So it is, and thank you so much for that kind a kind and generous introduction. Would you all mind if I shared some slides? Can I pop those up? All right, I'm gonna grab those real quickly here. See. Can you see that okay?
Yes, we do.
All right, we've all gotten really good at that, right?
Yes, really great.
Yeah. So again, thank you, UK, and I want to say thanks so much for District 5 for what you're doing on this topic, and the idea that you're hosting sessions on this and this third series. Thank you, President Liu, and thank you, President Simon Waterman, for what you're doing on behalf of all nurses in Maryland and beyond. And that idea that you're doing this is pretty incredible. I was very inspired when Pam checked in with me to comment about the sessions that you were managing. What I'm hoping, I know somebody's already commented on it in the chat, but I'm hoping people can be on camera and participate with me a little bit, because I'm going to give you a test right out of the gate. So who can hold up 3 fingers? 3 fingers. Okay, I see a few. Don't, you know, Caroline, I don't want you doing it. You're driving. Oh, all right, that's all right. You know, you can wave at me with 3 fingers. So the 3 fingers are going to be, there's going to be a test at the end for 3 R's, and you can chat these in because they can help you remember it. They're going to be for reckoning, rumbling, and revolution. Reckon, rumble, revolution. That's going to be the test at the end. So if you can be on camera, help me out a little bit. That'll be more fun. So next thing I want you to think about is important life events. Who's ever been a patient in the hospital? All right. There's probably a nurse there, right? Who's ever had surgery? This is not a HIPAA violation, but a nurse was there, right? Somebody here, I bet, has had a baby. I'm going to bet a nurse was there, right? Somebody was a baby. Everybody here was a baby, or maybe we just act like babies, but you know, a nurse was there. And the reason I make this point of emphasis, for so many special, important, sometimes the happiest day in our life, sometimes the saddest day in our life, a nurse was there. And I like to always say a nurse was there knowing and caring and linking compassion and science, because that's what we do. A nurse was there. I have been, oh, that was the 3 R's test. I missed the slide. I've been honored to be a nurse for 40 years. 40 years this May. That is in fact me. Back in West Texas 40 years ago. And I think about that title of being a nurse for that long. And when I think about that title and the privilege of wearing the title of being a nurse, it's the title, besides mom and wife, it's the title that I value most. And it's actually the title I've had the longest. So when I think about that time span, the last 2 years, I couldn't be more proud of what I've seen from our profession and all that we've experienced, the strength, the voices, the caring. And again, I applaud District 5 for celebrating this. I also want to emphasize that, oh, by the way, can anybody tell me what this machine is? Because like it's like a mystery. I've stumped many people with what exactly is that back in 1982. Chat that in if you come up with what that is. But what I want to go back to is no matter what your circumstances, no matter what you have going on in your life, these last 2 years, from March 2020 till right now, they've had change. For every one of us, they've had loss. And I imagine also they've had hope and they've had gratitude. I actually want to scoot us through that timeline really quickly and just center our heads on it for a minute, from March 2020 to May of 22. And also think about, when can you remember another period in your lives of 26 months with such precision? Like I don't even have to read my notes to recall March 2020 to May 22. And then sometimes do you think, what was I doing in January of 2020? You ever do that? Or early February, as the world was changing, and here we are. So very rapidly, this timeline, in March of 2020, the first patient was hospitalized in Maryland, and we began to think about masks and goggles and gowns and ventilators and proning. In May of 2020, and so our first patient was hospitalized, but in May of 2020, in my hospital alone, here at Arundel Medical Center, by then we had 100 patients in the hospital in that short amount of time. And you all remember, ORs were shut down. There were no visitors in the hospital. School was canceled. We were on lockdown. Grocery stores were empty. And then by August, we thought it was over. Remember that? August of 2020, we thought it was over. But by November of 2020, we didn't have enough ICU beds left. But by 2020, December, the first person in the United States got a vaccination, Sandra Lindsay, a registered nurse. And by January 21, we surged again. And by July of 21, we were down again, back down to 0 patients in many hospitals in Maryland. And then by August 21, you remember this circumstance, healthcare workers must be vaccinated or routinely tested. That was not even a year ago that we were managing that bit of our timeline. And by October of 21, we had the Delta surge, and then we were down again. And by January of 22, Omicron, and crisis standards of care throughout Maryland hospitals. February of 22, I got COVID. I'll remember that in terms of my personal timeline. And that takes us to May of 22, the National Nurses March in Washington. And here we are, May of 22, with yet additional uptick in cases. Think back across this 26 months, what you have experienced in terms of change, loss, hope. And that idea that for many people, the nurse was the person there. For many people, there were not family members in the hospital. And it didn't matter. I mean, I've used this statistic many times. I've had a peak of 400 patients in the hospital. 150 of those patients had COVID, but that meant 250 other patients needed something else. And in all those cases, a nurse was there. And so I want you to really think about this time period. What happened to you during this time period personally? What have you experienced from March of 2020 to May of 22? How has it changed you? What I hear from many folks on our team, many of our registered nurses, I hear this experience, and I've certainly experienced, and many can relate to these concepts: fear for yourself, fear for your family, uncertainty, job concerns. Remember, we had some roller coaster with patient demand and volume changes that impacted jobs. We've experienced horrific impact and a different recognition of the injustices in our nation of systemic racism. We've seen health inequity and understanding that in a way that maybe just wasn't at the forefront before. We experienced other things: challenges in politics, economy, interest rates, cost of gas and housing, and the cost of groceries. All of these things have impacted us, and certainly many of these issues were in existence, but so much magnified over these last 2 years. You had different experiences with holidays, with birthdays, with anniversaries, with travels. People across our teams have experienced loss of income and a sense of isolation. I'll tell you on a personal note, I remember like yesterday when I couldn't see my 2 girls. When we were in, and I have 2 grown-up girls, and I couldn't see them. And then I found out they didn't want to visit me because they were afraid they were going to make me sick. And I can remember it like it was yesterday. I lost both of my parents over these last 2 years. I had a daughter, my eldest daughter, with perinatal loss. I note those for you because I recognize we all have this personal experience and this personal sense of what has happened to us concurrent, and every one of us has a story. By the way, that elder daughter, which a couple of folks on this in this gallery know, is now 20 weeks pregnant, and we'll have our first grandchild here in October. And that other kid that I didn't get to see for a little bit, she got married last weekend. So the reason I draw that contrast is to think about, over these couple of years, professionally and personally, what is your experience? And I'm going to ask you to do this. Wherever you are, we're going to take about 10 seconds, and I want you to thank somebody. So you can thank a dog, you can thank a family member, you can thank a partner, you can send a chat, but we're going to take about 10 seconds. I got you on a timer, and we're going to ask you to thank somebody right around you, okay? Go. Everybody's better be doing it. Okay, did everybody thank somebody in 10 seconds? Promise? Okay, how does it make you feel?
Good.
It only took 10 seconds, right? And you thanked somebody. And I believe that we just had, we're across Montgomery and Prince George's County, we just had a serotonin surge because you all took a few seconds and thanked somebody. And it makes our brains better, and it makes whoever we're thanking feel better. So now's time for that test. Oh, by the way, I wanted to share some personal pictures of that timeline. This is when my girls wouldn't come in the house to tell Dad happy birthday. Some early visions of when we were just really understanding early on in the pandemic. The craziness of understanding how we're managing IV pumps outside a room. And I want you to rest on this concept, because I got a couple of comments about the heroes work here phenomena. So onto the 3 R's. I'm a big fan of Brene Brown. I really, really enjoy her writing and her learning and teachings about life and how to apply it in all kind of realms of our life. And we certainly don't compartmentalize it. And she says that when we're managing setbacks, when we need to bounce back, that we can go through 3 phases. And those are those 3 R's that I'm asking you to pay attention to. In this book, which now feels like a long time ago, 2015, she says that we have to reckon, we have to rumble, and then we have to build a revolution. So my question to you is, how do we as individuals and as a profession view the challenge of the pandemic? How have we done the work of reckoning, of rumbling, and of revolution? In terms of reckoning, she says this is what, when we're reckoning with something, and I can think about that as I review the timeline, our emotions are high, our physiology takes over. We're saying something's got a hold of me when we're in that period of reckoning. What she says that we do when we rumble is we write our own story. Write the story about what we think. And it may not even be factual, but it's your story. And you write the story and you say things like, the story I'm making up is this. My emotions tell me, in my body I feel. This is what we do when we're rumbling and we're trying to make sense of something. And in revolution, we take that reckoning and that rumbling and channel our insights into positive changes. So I ask of you all, in these 2 years of altered practice, of recognition of the workforce shortages, how did we get here? How do we reckon with that? How do we rumble with it? How do we celebrate the revolution that is to come as we ensure what we need for our healthcare workforce and what we need for registered nurses? What has happened to us professionally? This is my reference. This is a great paper that was actually, the content for it was from the very early months in the pandemic. And it focuses on this concept of us being called heroes. And the idea that we, I think, have appreciated that notion of being called heroes, but it's not enough. We are not just a necessary sacrifice, nor are we just model citizens, and nor is being called a hero enough. That we can reckon with this experience, we can rumble with this experience, and we can revolutionize what we are to be through this experience. and that it has long-standing implications for what we do. And this was drawn, this is again an excellent paper drawn from very early on. The next one reference I want to make is just issued this week, which I am very, very inspired by. It's the Surgeon General's paper on addressing burnout. And that I hear a reference to Children's National on the line, I think.
Yes, they are.
I think this big announcement came at Children's on this paper, if I'm not mistaken. Why I'm inspired is I think back to that early period in that first paper I mentioned, and this workforce paper from the Surgeon General Advisory on how to think about burnout. And I put those together, and I'm inspired by the recommendations that exist. So in your job, in our profession, in your role, personally, how are you reckoning, feeling this, understanding it's gotten a hold? How are you rumbling and writing the story? And then what are we doing in terms of leading the revolution for what's next for us? And what I think series like this are very, very emblematic of it. I'll end in this. I think some of the key elements that have been published on nurse staffing, this came from the nurse staffing think tank that was a blend of many organizations, including at the top, the American Nurses Association. And I'm very proud to say that I now co-chair the next version of this, which is the National Nurse Staffing Task Force. The key elements addressed in this particular paper that was the output of the think tank address compensation, care models, scheduling, healthy work environments, equity and justice in our profession, and a recognition, as you all have so well done, on the need to pay attention to post-traumatic stress and the issues of well-being that are considered in our profession today. So I'll leave, no, I'm not going to leave, but I will stop on this. First, you got to pass the test. What are the 3 R's? You can, it's probably in the chat and you can cheat if you want, but somebody unmute and tell me what the 3 R's are.
Reckon, rumble, and revolutionary.
Awesome. Was that Amma?
Yes, ma'am.
All right, thank you, Amma. All right, you passed the test. I'll hand it back to President Liu and say again, thank you all very much for leading, for celebrating, and managing all the reckoning, rumbling, and revolution that is necessary for us. Back to you.
Yeah. Well, thank you so very much, Dr. Perkins, for such an outstanding presentation and bringing us to the point of really thinking about the last 26 months and how so much changed in that time period. So now we're going to open up for a few questions from our audience. And if anyone has a question, feel free to just unmute yourself and speak up. And while you are thinking about the question that you want to ask, I'll get us started with one question. And as you were talking, Dr. Perkins, one of the things as a leader of a major hospital system, what are some of the changes that took place during this 26-month time period that you think will be enduring over time? What's going to change about what we do, how we do it, how we work as nurses?
you know, I think that I don't know that it's a change maybe from philosophy, but I think there's a much different focus on acknowledging what we're doing here today, and that it's on well-being and all that that means. You know, we sometimes have said in a fairly flip way that well-being isn't about providing the teams pizza and an app. It's about really thinking about what makes a healthy work environment. How do we make a work environment better for avoiding workplace violence? How do we say to folks, I was talking to somebody about this yesterday, one of our teammates, and we said, wouldn't it be great if we really had people truly taking time off to replenish, to restore, and that becomes the norm, that this sense of sacrifice and lack of boundaries that we've influenced in our profession, if we could make that go away. So that I'd say that will be enduring. And I reflect on it because of what we've all experienced personally and what the profession has experienced. And the recognition of how many things each of you juggle.
Yeah, thank you so very much in bringing that perspective and that lens to think about how important that well-being really is. Are there any other questions? I'm going to open it up. UK, I think you look like you're about to say something.
No, not really. I'm still excited.
Oh, okay. All right. Thank you.
So I am just gonna jump in here for a minute. Thank you so much, Dr. Perkins. I mean, such a timely presentation, and those 3 hours. So, you know, I guess my question is something that I think the nurses might be thinking about at this point in time. Where do we see, what are the things that we need to do to have that revolution, right? And how do we see ourselves as an organization, as a profession, moving forward? You know, we hear the word revolution and we think we're fighting for something. What things as nurses do we need to put in place from the bedside to the boardroom to ensure that that revolution is taking place appropriately for our profession?
Well, you know, that's our, I'm going to draw back on this think tank and the key elements of that think tank that and again, if anybody needs a link to that, I could actually pop that link in the chat, and that might be useful to you. But Christy, what it references are these core elements, and we all know it starts with safe staffing. I mean, it fundamentally starts with safe staffing. And how do you get to that? And the way that this think tank approach that is that safe staffing we get to through comp and benefits, through flexibility in scheduling, through the appropriate care models. And I do think that we are having shifting care models that we have to think about through a different approach in our profession, particularly to avoiding the racism that has existed systemically in nursing and the demographics of our nurses. And then this attention, again, real attention to what it means to have a healthy work environment and a recognition of post-traumatic stress. So if all of those elements can converge and we address those through, and you said it, from the bedside to the boardroom, but I'd also say with regulators, with others, to help us get at those actions. We all know, I mean, you saw my picture. We've been at this shortage situation, well, however you want to define shortage, for decades. And this has tipped us. And somehow I believe we can rumble and rise out of this. And you said an interesting thing, and I don't think Brene Brown means for revolution to sound like a fight. And we're not fighters as nurses, right? We're collaborators, we're colleagues. How do we do this in a way that reckons, rumbles, and revolutionizes it, but in the way that nurses do for long-term change?
Yeah. And I think it's so true, but I really think that it's important as professionals, that we understand the power that we hold. We are one of the most trusted professions, I would say, in the world.
I think we just hit 20 years.
Yeah. So, and I think we really do, as a profession, underestimate our power and how we need to utilize it. We cannot allow, lawmakers who have no idea what it takes to get into a room with a patient who's sick and is on a dying bed to make the policies that dictate us. It's very important for us to get involved. We need to get involved, not just advocate for our patients at the bedside, but advocate for ourselves and our profession, right? So I think, extending that knowledge to nurses and allowing them to be as creative as they are at the bedside, to go to the legislator and say, this is what we need as a profession. These are the things that we're facing, and these are the things that we need. So, part of it, I think, would be the education piece and allowing nurses and the profession to understand we are powerful. We are not just powerful in holding patients' hands at the bedside or when they're most vulnerable, but we are powerful in making the policies that we want to dictate the way that we practice. So, and I think part of that revolution is us coming to that point of acknowledging the power that we hold and what it takes for us to utilize that power.
I am with you. I think there's a real call to action in this Surgeon General paper.
Yeah.
Think about across these 26 months, this recognition. It basically says our nation's health depends on addressing this.
Yes. Thank you.
I just want to also add that I think, and we have mentioned this evening, that we really need to educate and make sure that our nurses are taking time out and observing self-care, which is very important because, if you are in the flight, you are taught to put the oxygen mask first on you before you could save someone else. So we do too much. We not only take care of the patients at the bedside, but most of us still come home and continue with our roles. So I listened to a young man just last week, and he just told me pointedly that he's experiencing PTSD from what he's experiencing at work by not even have taken a break to the bathroom. Sometimes that's what it takes for him to complete his shift. So we are doing a lot. We have to learn to take care of ourselves so that we can better take care of others. Thank you for letting me share.
I'm so with you, UK. And I think somehow we haven't always, as a profession, made that okay. We haven't managed, systematic programs within our hospitals or other work environments that encouraged. What about when we have an important error or important loss that builds second victim support? So many elements that we can normalize and bring to bear.
Thank you all so very much for such great questions, responses, and for sharing and reflecting ideas for us to all reflect on. And let's give Dr. Perkins another round of applause for such a wonderful presentation for us this afternoon. We really, really appreciate that, and we know how busy you are, and really taking the time out to share your knowledge, your experience is absolutely wonderful. And now I'm going to turn things over to our President Lou, who has a real visual delight to share with all of us, honoring and recognizing nurses from the D5 area. Lou, take it away.
Thank you so much, Dr. Perkins. That was really, that was an exceptional presentation, and we would love to know if you could put in the link to that article, the newest one. And but just give me 1 second and I will start the presentation, recognizing all of our nurses in D5. We recognize, you'll see students from Prince George's County, nurses and students from Montgomery County College, Children's Hospital, and then all of our members are also listed of D5. So please sit back and enjoy. I just have to share my screen here. Is everyone seeing this screen?
Yes.
Perfect.
I'm Shannon White, a pediatric nurse at Children's National Hospital in Washington, D.C. The past 2 years of being a nurse in a pandemic were nothing I ever thought it would be like. If you were to ask me 7 years ago when I was graduating nursing school, would I be ready for a pandemic? I would say absolutely, throw me in. And then having 5 years of experience working on all acute care floors, I was not prepared at all for what a pandemic would mean physically, emotionally, socially, as a nurse. However, it goes without saying, the pandemic was hard. It was hard on everyone. It was hard on patients. It was hard on the healthcare system. It was hard on nurses. It was hard on doctors. But I would say overall, it increased my connection with others. I think that I tried to go above and beyond to connect with my patients while I was wearing a mask or a PAPR or goggles or glasses. I tried to be at the bedside as much as I possibly could, even though we were trying to avoid going into rooms as much as we possibly could. I know that I felt connected with the travel nurses who came to help us. I know that I felt connected to the ICU nurses I got to know when I floated to the ICU just to help out when I could. I know I felt connected to family members. I remember there was one night I was working night shift and there was one patient who always had a family member on a Zoom, whether she was sleeping, whether it was 2 a.m., 8 a.m. And I remember talking to this patient's aunt at 3 o'clock in the morning while the patient was sleeping. So even though it was hard, even though it may have been discouraging at times, it changed my career trajectory. It changed, I think of myself as my personal life, who I think of myself as a nurse. I think overall, I felt connected to staff, and even in the hardest times, it was a joy to be able to show up to work with my staff members and get through the day.
Hi, everyone. Can you hear me?
Yes, we can.
Yes,
Sorry
yes.
about that. We had a little technical difficulties with the music that was playing there. And I had to take my headphones off to actually, for the music to play, I figured out. But that was just a little bit of recognition that we had that we were able to share with you from across the district that included Prince George's County, Montgomery County, and Washington, D.C. So I will now turn it over to Vernell to introduce our last sort of speaker and to give us a toast to the Maryland Nurses Association District 5 nurses. You want to
Everyone
mute,
enjoyed,
Vernell?
everyone enjoyed watching the pictures, although the audio didn't come through the way you had planned. It was great to see the faces of so many nurses across this area, Montgomery County, Prince George's County, and the District of Columbia. So that was really, really great. And now we're going to move on to the next portion of our programming. And it is my honor and pleasure to introduce, well, to present to many of you and to introduce to others the president of the Maryland Nurses Association, Dr. Saman Waterman. She is a family nurse practitioner, a member of Sigma Theta Tau International Nursing Honor Society, a Jonas Scholar recipient, a fellow of the Nurse Leadership Institute, and an advocate for advancement of quality health care for all. Her passion and devotion to her beliefs in caring for her clients, as well as her priority of education and health prevention, are demonstrated through her innovative utilization of telehealth during this COVID-19 pandemic. With the use of telehealth, she was able to successfully double the number of clients that she examined daily. Dr. Waterman works long hours and spends a great deal of time providing the appropriate intervention needed for the most positive outcomes associated with her patient population. Dr. Waterman is currently employed at the world-renowned Johns Hopkins Hospital in Baltimore, and she continues to serve as a coach and mentor to aspiring nurses and nurse practitioner students. She is a champion for health and healthcare policies and serves her clients with the utmost honesty, integrity, wisdom, and gentle care as she guides their health journey. She is a member of the executive board and currently serves an extremely vital role as an active and engaged member of the legislative, finance, and convention committees of the Maryland Nurses Association. Her contributions to the nursing profession include publications with DNP scholarly projects, publications in the Journal of Nurse Practitioner, as well as the Maryland Nurse News and Journal. During the Maryland Nursing Association 118th convention, Dr. Waterman's work was recognized with the Nurse Superhero Award. Congratulations to you, Dr. Waterman. And now, please take it away.
Thank you for that introduction. Thank you so much. I'm humbled. And good evening again, everyone. I bring greetings from M&A Executive Committee and Board. I just want to say Happy Nurses Month to all our nurses. Thank you for having me here this evening to celebrate with the nurses of District 5. In celebrating nurses during the month of May, M&A has used this month to promote self-care for nurses, to improve our lives at home and at work, which is urgently needed after the increased stresses brought on by a pandemic. Despite the loss of lives and livelihood during COVID-19, there has been numerous opportunities for growth and to change mindsets and practices that have been toxic to us as inhabitants of the world. In what direction are we prepared to take our profession. Humanity depends on us to be successful, and we must not fail them. I urge you all to think of how we can get even better and take our profession into a new era, an era where the role of the nurse is not reduced to a stereotype, but seen as the valuable resource that we are. Nurses can be the leaders in creating healthier communities and a more effective, efficient, and equitable system of healthcare. M&A brings us together to accomplish these goals. This evening, I want to take the time to say thank you to District 5 President and Board for your exceptional leadership. It's shown here with this program that you just provided for us. To those D5 members who were recognized, congratulations and thank you for making a difference in your community. And to all the nurses here tonight, I say thank you for being superheroes. You are indeed phenomenal human beings. What you are doing for your district, for your country, and for humanity is nothing short of remarkable. It is with the greatest humility and pride that I say thank you. You make me feel proud to be a nurse, and I am happy to call you all colleagues in this profession. So this evening, I want us to all to raise a toast to District 5 President, Board, and members for being the superheroes in your community and the state of Maryland. Salute to all of you excellent nurses. Thank you.
Well, thank you so very much for such warm, welcoming words and comforting words, and recognizing the work that nurses do and the contributions that we make to all of our patients every single day in so many different ways. And we hope that you all have enjoyed our time here together. And now we're going to go back to Lou, our president for District 5, and have him to close us out for the evening.
Thank you so much, Pernell. Before we depart, I would like to leave on a high note and share how nurses impact families on a daily basis by reading a letter from a patient's family provided by Children's National Hospital. Just a little background on our expertise when it comes to hospital visits. We have 3 children and 2 with special needs who have been hospitalized many times over their short lives due to surgeries and investigations of problems. For this particular visit, we arrived at the hospital around 8:00 p.m. due to being admitted for the remainder of the evening to prepare for a bone marrow biopsy the following morning. We came to our room and were quickly greeted by Joycelyn, with her smile on, ready to care for our daughter. I'm not talking about the run-of-the-mill nursing that is simply ready based on their training. I'm talking about your nurse already knowing the background of most of your child's extensive healthcare interactions before you say one word. When gathering history, we were simply blown away by how Joycelyn was so amazing and how she invested her time into knowing about her patient. We've probably had hundreds of nurses over the past 5 years without children, and I can honestly say that Joycelyn was the best out of all of them. She was on top of our daughter's care, assisting the whole way, and made sure that she was tracking everything that went on, along with the depth research she conducted to best be part an advocate and caretaker of our daughter. She showed genuine care and respect to us and our daughter, making sure to build a rapport with our youngest daughter so that she felt safe and secure with her as her nurse. The single experience adjusted our whole perspective on hospitals as a whole. Joycelyn is a dedicated nurse that put my daughter and our family at the forefront. We are honored to have had her as our nurse and truly hope to have her again next time. This was awesome. This letter shows us just how instrumental that this profession of nursing is in caring for all of the sick. Thank you, Children's Hospital, for sharing that letter with us so that we could share it with the rest of our district. Tonight was a wonderful program, and Dr. Sherry Perkins, your presentation was inspirational to all of us as nurses and as colleagues with the district, throughout the district. We are so grateful for you to have taken time out of your busy schedule to be with us tonight. Also, a special thank you for our delightful M&A president, Dr. Christy Simon Waterman, for joining us addressing D5 with those beautiful words for nursing. This webinar will be added to our YouTube channel and will also be included on our website. But finally, thank you all to all of our members and guests for attending. And please be safe as we start off this holiday weekend. As nurses, we are compassionate and empathetic to our patients and their families. So please keep the victims' families in Uvalde, Texas, in your thoughts and prayers. And again, thank you for attending and good night.
Thank you, everyone. Thank you for coming and have a wonderful evening.
You too, Dr. UK, and everybody.
Thank you all.
Thank you, everyone. Thank you. It was a pleasure being here. Thank you so much.
You're
Thank
welcome.
you for being here, enjoying and sharing your words with us.
Thank you. Good night.
Good night.
Good night.
Bye-bye.
Good night, everyone.